Good afternoon, everyone. As the rest of the crowd files in, we'll go ahead and start our last plenary session for the day, titled The Second Half with the HHS Program and Acquisition Officials, moderated by our HHS OSDBU Director of Operations, Mr. Joshua Blow.
Good afternoon, everyone. Oh, wow. Okay. Good afternoon. Oh, okay. All right. Thank you guys for joining us for this afternoon session. We really appreciate your being here to participate in this. I want to say thank you to the panelists before we get started. Shannon has used the theme of game day. And so we've had a couple of last minute substitutions for this part of the game, but we appreciate them joining in to help out. So we're going to start with introductions. As Ms. Taylor said, I'm Joshua Blow. I'm the Director of Operations in the Office of Small Disadvantaged Business Utilization. And I'm going to start here from my left to right and allow each panelist to introduce themselves.
Good afternoon. I'm Natasha Boyce. I'm your small business professional, currently supporting NIH, the National Institutes of Child Health and Development, and clinical centers.
Hi, my name is Sherry Randall. I work for the Centers for Disease Control and Prevention, Office of Acquisition and Services, Section Leader Contracting Office, and I support the National Center for Immunization and Respiratory Diseases.
Hi, good afternoon, everyone. I am Elizabeth Fuller. I am with ARPA-H. We're a relatively new agency, the Advanced Research Project Agencies for Health. If you've heard of DARPA, we're kind of based a little bit on there, but obviously like on the health side. We've been in place for 2 years, and I've been there since August of 2022, so almost, at that time. Our birthday was March 15th, so just a little over 2 years old. And I am working in our Business Innovation Division, BID, so we have a little name thing there to show that we are our acquisitions office. We also award financial assistance, things like that. And I'm the division director for our optimization, policy, and systems division. Thanks.
Good afternoon, everyone. My name is Paul Rodriguez. I am the deputy director for operations in the Office of Minority Health. Since we're doing birthdays, OMH's birthday was in 1986, actually as a result of the 1985 Secretary's Task Force Report on Black and Minority Health, more commonly referred to as the Heckler Report. That's what established OMH. So pleasure to be here.
Thank you, guys. So the purpose of this panel is to provide an opportunity for our programming and contracting officials to share their perspective for best practices on doing business with HHS. And this session will consist of 2 parts, hopefully time permitting. The first part is questions that we already have that are scripted that the panel are going to address. And then the second part, if time allows, will be questions from the audience. So we are going to go ahead and get started. So Elizabeth, does your office engage with small businesses apart from posting notices as a part of the market research process?
Yes. And so our biggest things is for ARPA-H is our research and development. So the agency is really set up to make these huge health breakthroughs. So nothing easy, not a lot of things that are like already in progress, but these big, like our director like say like the hair on fire ideas, like if only you could do this certain thing, then and we could fund this certain thing, then we might have a huge health breakthrough. So for our R&D projects, we're having things that are similar to industry days, but we're calling them proposers days. So keep the lookout for those. So proposers day we're doing for each of our programs. A lot of times they are in person and also hosted virtually. So you'll see a lot of those coming out. So that's a great way for industry to check out what ARPA-H is doing. You can come communicate with the program managers are there. They usually have guest speakers. The awarding officers, like our contracting officers for OTs and cooperative agreements are there. Yeah, it's just really a great way to network and see everybody for the particular programs that they're working on. Also in our innovative solutions openings, which is our solicitations for our research and development, our R&D projects, we're requesting solution summaries. So you may have heard of white papers or abstracts. We're calling them solution summaries, which is just a few page article to say, here's what our industry wants to bring to ARPA-H as a solution to a huge health breakthrough. So in that case, that's a great way to get your foot in the door, get ARPA-H to know you, and give the idea that you are hoping to propose. We also have 2 hubs. So congressionally, ARPA-H is mandated to have 3 separate locations. We have one DC location to make sure that we're able to communicate with federal government agencies, and we're local to a lot of the feds, right? So our big stakeholders. And then we also have raised this congressional requirement and said, all right, we will have 2 other hubs in our consortium that we were calling ARPANET H, based on like the intranet. So 2 other hubs, one for investor catalyst, think like business to business relationships, and the other for customer experience. And in this one, you can think like patients to doctors, human-centered design experience. And so these 2 consortiums already have over 450 spokes, we're calling them, basically like industry that's working with the consortium to pitch on different ideas that ARPA-H is bringing forward. So that's also a really good way to interact with ARPA-H, and you can check that out on our website, arpah.gov, and under Engage and Transition, you'll see ARPANET H, and you can apply to be a spoke to one of our hubs in that manner.
And Paul?
So OMH being a smaller staff div of HHS, we don't have a routine engagement plan set up for small business. What we do is we partner with our larger sister organizations throughout the department to essentially access some of the opportunities that they're identifying. One of the other things that we've done more recently and effectively is work directly with Joshua's office to identify and leverage that existing network of small businesses. We found that to be very beneficial. We actually have some lined up currently, but that's how we've operated as a smaller staff div. Obviously, if you're a larger operating division, you can quite often post things where you're drawing small business directly to you. But in our experience, what's worked most effectively for us is partnering with others that have already established those connections that would fit with the work that OMH does.
Another question for you guys. If a small business wanted to do a capability brief with you, is that something you would do with them? And if so, or if not, how do you recommend small businesses go about trying to engage with you?
There it is. So certainly, yes, we would welcome capability briefings with small business. The way it typically works with OMH is we would request upfront kind of an informational introduction that would come from the small business directly to OMH that would highlight the areas of expertise and the experience that aligns with the work that OMH does. Once we get that in-house, what we typically do is we, on the leadership team, will review it and understand if it's a good alignment with any of the initiatives we have for that particular fiscal year. If so, we reach out to the POC and then we schedule out from there. So basically, it's a way for us to find out upfront if there's that alignment that would work with our current initiatives. And if so, we would go to the more specific capability briefing that would follow that informational document that came firsthand.
And like you said, Paul, I think you and I worked together on, I think it was 4 different requirements that we went out and looked for small business capabilities to potentially do capability briefings for. We did it last year and we've done it again this year too.
Yeah, one's on tap.
Yeah.
Very
so
recently.
I can attest to the fact that they are looking for you guys, and I've worked with them personally to try to find opportunities for small business. So, Elizabeth.
I have to go back to pitching proposers days and things like that. We have a very focused federal staff in ARPA-H. And as I mentioned, our main focus is our R&D work. So I'd like to talk in different colors, I've said at work sometimes, like, okay, I'm over on this green side, we'll say, with R&D work. And in the R&D side, we're awarding other transactions, or we're awarding cooperative agreements, a lot of universities, nonprofits, small businesses on that side. And on that side, really like focused R&D projects from our program managers. We have 14 of them on board right now. So I think that's really like follow along on our website and figure out, what fits for your industry to come in and speak with us that way. On the procurement side, we have a limited number of staff there too that are working to, typically award the FAR-based contracts. So for things like that, you'll see like our RFIs and source of SOTs and things like that out, and we can definitely hold capabilities briefings and things like that as necessary for the procurement side, but we're just doing a little bit differently on the ISO innovative solutions opening side and the R&D side.
So Cindy, since we start with you, can you talk about some of the challenges with engaging small businesses? I'm sorry, I said Cindy. I meant Elizabeth. I'm sorry.
Off the hook on that one. I guess not. Sorry. So the challenges of engaging
with small.
businesses. Yeah, I think it really is like the focused nature of like how we need to be right now. Like every engagement needs to be strategic. So we're just really focusing on those like in-person and virtual meetings and things like that. And then really to the programs.
And I want to ask our other two panelists, what are some of the challenges you've had with engaging small businesses for opportunities at HHS?
I believe one of the big challenges is making sure that small businesses believe that we're in the business of reaching out to new entrants. So that's one challenge and it's a challenge both ways. I'm talking to the vendors and I'm talking to our acquisition officials to make sure that our acquisition documents appear that we are definitely looking for new entrants, we're looking for small businesses, and that it doesn't appear that the requirement is rigged. So that is a big challenge with engaging small businesses, giving them the confidence, ensuring them that HHS is looking for them, and just making sure that they know that if some of our documents, they may be done in a very quick fashion, and you're always welcome to comment on our documents if it does look like it's rigged, because I can assure you that most of the time, these documents are put together as quickly and as professional as possible, but sometimes things are missed, and we're always looking for your input to improve our procurement process. So I think that's one of the challenges in engaging small businesses, is just making sure that you guys know that HHS is really looking to work with you to meet our mission.
Did you want to add?
I don't think we have any challenges engaging with small businesses at
Right, 'cause you guys-
CDC. We just got that award.
Yeah.
So I think for CDC, I think maybe sometimes small businesses feel that they aren't able to engage with us. And so we've been trying to bridge that gap. And earlier in February 20th, we had our CDC Small Business Symposium. And I think it's our first ever time that we've done something like that. And we had small businesses come and we had our program offices to come and speak about upcoming requirements for fiscal year 25. So I think that, we're just trying to make sure, because we need each other, industry and government, and, small businesses, you all play such a very important role, and we do need you all. So I would just encourage for small businesses, keep engaging, keep reaching out to contracting officers at CDC and at other federal agencies. But, just make sure that when you come to us, that you understand exactly, what we buy. For example, I support NCIRD at CDC. So if you come to me and say, hey, I'm a construction company, can I meet with you? Well, I don't support construction, but I might be able to direct you to the contracting officer team or whatnot that supports that particular program office, So, we're doing better to engage with small businesses. But again, I don't think we really have a challenge. I don't think small business, we don't have a challenge finding small business or engaging. I just think for us as a whole CDC, we're just trying to do a better job of reaching out to you all because you do a great job of reaching out to us.
You brought up a good point. You talked about knowing who you're engaging with with the small business to do some research on the agency that they're trying to connect with and what you all do. Natasha, could you talk a little bit about your experience with that from the small business professional side and how you see that impacting small business engagement?
I think one of the most important things for small businesses to remember in knowing what we do is that, well, first, after you research what we do, it's important that you also research what is the acquisition strategy. So for all of our optives, there are a number of internal IDIQs and GUIs that may be used. There are so many vehicles that we can take advantage of through category management and best-in-class vehicles. So it's very important to do your research through all of the various avenues for gathering information, whether it's our forecast, our budget and brief, online information, our expiring contracts report. There's so much information out there. And then once you gather that information about what we buy, it's important to know how we buy it so you can research, okay, how do I get on this vehicle? When is it coming up for recompete? Or should I team with someone who's already on that vehicle? So it's a two-parter, actually knowing what we buy and how we buy it, because we buy the same products and supplies in so many different ways.
Thank you.
Could I just add
Yes.
really quickly to that? You brought up a good point in the sense of like RFI, RFQ or whatnot, and when you're reaching out trying to find out if something is up for recompete. So a lot of times I'll get a call or an email from a contractor and they'll say, hey, Sherry, I know this particular requirement is up for recompete for administrative support services. Well, what else? You know, so it's helpful to have a contract number. You know, we don't speak in titles. And I mean, even if I did the requirement or someone on my team, I do so many things that I'm not going to remember what a laboratory support contract is or administrative support, you know, unless it's a very, very specific title that no one should forget, I'm not going to know. So if you have the contract number, that's very helpful, you know, and make sure you know if there's a difference between it's up for recompete and we're about to exercise the next option, you know. So those kind of things when we say do your research, or if you're trying to figure out, you know, what's happening with this particular solicitation, again, not the title, what is the solicitation number? Because again, we don't deal in titles. We deal in specific, what's the number? Because I'm usually more than likely, if you talk to a contracting officer or specialist, they're going to say, what's the solicitation number? What's the contract number? Because we have a database for us to look everything up. And I promise it's not by title. So
what I hear you saying is do your due diligence. You have more information at your disposal than you sometimes realize and more resources available to you than you might know. We have our SBCX portal. We have sam.gov. Contract information is public. When you reach out to us with an inquiry, like she said, I received one last week from a very experienced firm with just a description. I have no idea where to get started with that. I don't know what to do with that. So the more information you can provide us to get you the answers you need, the more likely it is that we can get you a response. So and this is for any other panelist, does your office have a need for simplified acquisition purchases? And if so, how do you go about making small businesses aware those opportunities exist?
I'll start and you'll probably get a better answer here in a second from somebody else. We do, but not a lot of them. So that's why I'm like, you probably get a better answer somewhere else on this panel. Right now, since, you know, the agency is relatively new and we're just starting up, a lot of our acquisitions have been bigger and we've been really focusing on the R&D stuff. But for anything that's simplified acquisition threshold, anything on the procurement side and even our R&D side, you'll see on sam.gov. So really, we're just using that main portal. We don't have anything else for that lower threshold in the 25K that's going somewhere else on any other, portal anywhere else. So you can just go to the typical sam.gov website and you'll see all of our requirements for SAT stuff.
Not to put you on the spot, Elizabeth, but I believe ARPA H has a small business set aside requirement out on sam.gov right now, correct?
We do have the SIBR Sitter program that is out. It currently closed. So we had about like 6 different topics on there. It was released by NIH. So that's another thing that ARPA H is doing right now, is being supported by a lot of other offices as we're getting set up. So we were established with a direct line to the HHS secretary, but also NIH is helping us get set up. So NIH is they posted our solicitation for the SIBR Sitter program that was out. Currently topics are all in and being evaluated at the moment for award, but they're planning one coming up very soon in the spring, and there'll be new topics from our program managers, depending on what focus areas the program managers, these ARPA, huge high level scientists, those ARPA PMs, from their ideas, we will have another SIBR solicitation out very shortly that can be proposed through. And then I'd like to thank the National Cancer Institute for helping us award those at the moment.
The other panel.
Oh, I would like to add that for simplified acquisitions and those smaller buys, you want to make sure that you review the bid boards. NIH has a bid board, FDA has a bid board. And then it really just depends on the optive. Again, since I have more experience with supporting NIH, their team has a specific simplified acquisitions team, versus maybe at FDA, all of their contracting officers, may have simplified acquisition awards as part of their portfolio. So it really just depends. And, just continue to be diligent, and you can reach out to us, your small business professionals, or reach out to the optives to ask that specific question on how they procure their simplified acquisitions.
So everyone in our contracting office does simplified acquisition, and we definitely encourage our specialists to award to small businesses as much as they can. We usually advertise, of course, through sam.gov and GSA. So, and also sometimes if we see something, we might even do a direct 8A. And then, of course, depending on the dollar value, depending on the dollar value, we could get 3 quotes. Or sometimes, especially if it's under 10K, we could just go to anyone. But we really do try to make sure that we support small businesses, that we consider small businesses first, because we get a lot of requirements where our program offices they like to use who they want. So we have to encourage them to, kind of shake up the pot a bit, especially if we see a continuous, if we see that they're continuously trying to use a large business for certain things, when we know small businesses can do this type of work. So just rest assured, CDC, we do our best to especially give small businesses first chance at simplified acquisitions.
I just wanted to add one thing as it relates to the Office of Minority Health. Our statute requires that we work directly with 8A firms. So obviously we are looking in that direction at all times for the initiatives that we are moving through our fiscal years.
Thank you. Do any of you have any events or opportunities for engagement or actual acquisition opportunities for small business coming up that you want to tell the audience about?
Sure. Let's go ahead again. So just announced recently, we have, I think yesterday, we have an opportunity called Print, which is for 3D bioprinting organs. So that Proposers Day, I think, is coming up May 7th in New Orleans, also held hybrid, so virtually also, if you're interested in that. We are also releasing Mission Office ISO. So we have 4 mission offices. One of them is the Proactive Health Office, focusing on preventative care. And so for that Mission Office ISO, we have a Proposers Day coming up just virtually a week from now. So April 9th. I think that's maybe just about it. Except no, we have one other program called Heroes, which is focusing on rewarding health outcomes. and they are doing like a learning session. So the good news about like working in this like R&D field, especially like under the other transactions, is we are able to do what works for industry. So meet industry basically like on their playing field. So we're looking at doing different types of payments under that program based on outcomes. So if we're able to reduce the level of certain health occurrence like happening, then in that instance, we're able to pay the performer. So our program manager is holding 4 sessions there. One today at 4 p.m. to 5 p.m. if you're free and would like to join into that virtually, and then one for the next couple weeks to talk about how they're planning to pay under that program.
So if you all were at the CDC Small Business Symposium on February 20th, we had a couple of panel sessions where we talked about some upcoming requirements for fiscal year 25. So the one that my program office is doing, we're doing a center-wide IDIQ contract. And then there was another contracting officer who was here by the name of Dawn Redmond, and she spoke about a requirement. I have no idea what it's about right now. And then we'll have another one. So we'll actually have three different requirements that we plan to speak about on June 20th. It's going to be here. We haven't advertised for it or done anything, so please don't email me and ask me what's going on. We're just in the beginning stages of it, but we are going to have an industry day. It's going to be for small and large businesses, but I can speak to my IDIQ because it'll have domains, and we are definitely looking to set aside some of those domains just for small businesses to give you all an opportunity for that. And so that's something that's coming up. And then we do plan to continue having our small business symposium. I'm not
do your homework so that you won't be sending it to us and get mad with us. Well, I sent it to you and I didn't receive a response from anybody. I am so sorry.
Gwen, can I add,
Next,
I want
next
to
year.
I want to add to that real quick to see if I can help give you some strategic way to address your question and help you figure out a way to engage. One of the things I always tell firms, and some of you have met me out at different outreach events, and you've probably heard me say this before, but the SBCX portal has every small business professional that works on there listed by the agency that they support. If you reach out to a POC on the forecast and you don't get a response, first of all, I recommend that when you're trying to make that initial contact, CC the small business professional responsible for that agency. And that way we will know that it's on your radar. And then if you don't get a response, reach back out to that small business professional and see if they can perhaps reach out to the organization. As a former contracting officer, I can tell you, and most of the people in here who have worked as a contracting officer, they'll tell you, we typically have more work than we can do and less time than we can do it in with fewer resources than we need. And so it's not that they don't want to engage you. It's a matter of trying to balance priorities and meeting the mission. And so sometimes the .gov at the end of an email address makes a world of difference. So I recommend that you include us in on any correspondence that you have reaching out to those offices. Elizabeth, did you have something?
Oh, I just wanted to add on timing. During the sources sought, during the RFI, I think that's like the optimal time. That's when the government is looking for small business response. We're looking to set aside the requirements. We're looking for those 2 small businesses to say, yes, you're fully capable. So if you provide everything that the government is looking for, do your homework, check all the requirements, check the attachments that we're putting out with our RFIs and respond to all of it, then we're able to say, okay, you're fully capable of handling the requirement, then we're able to set it aside. So I think RFI and sources sought is probably the optimal time when we're doing our market research.
Absolutely, Natasha. Yeah.
Yeah, I also wanted to add as well, I wanted to assure all of you that you're doing the right things and being resilient and being persistent. We wish we had a set timeline for all of our procurements, but we don't. Some you may email us in September. We don't know anything about that particular requirement. And then you meet us at an event like this and the CO can tell you, oh, I'm putting that out on GSA next week. So that's just how the procurement process can work sometimes. But I assure you that you guys are doing the right things. You're being persistent when you're sending us emails with all of the information that you have and the points of contact. And as far as a small business professional, what I try to do is make sure that you have as many points of contact as possible, because our contracting officers, our program managers, also they move to different jobs, they move to different positions. So you want to make sure that you're always gathering information and taking notes on who are the team leads, who are the directors, how is that organization structured? Do they have an IT team? So at least that you should be forwarding your questions, your inquiries, and your capability briefing requests to that IT team. And so, if you attend the presentation we're doing this afternoon, we'll make sure that you have a list of all of the directors. So if the contracting officer is not responsive or they've moved on, I encourage you to contact those directors or the deputy and say, is there a better point of contact that I can reach out to? But finally, I just want to assure you guys that we hear you. We are working on being more responsive, more receptive. Last month, we just had a great training presentation with our acquisition professionals in collaboration with the Professional Services Council and some other vendors from your community. And they explained to them how we can communicate better with industry, how we can be more responsive. They gave at least 20 recommendations. And what we ended with in speaking to our contracting officers and program managers is that we told them, we know you are extremely busy, but pick one thing that you're going to do, whether it's speak to more small business vendors or whether you're going to issue an amendment to your sources sought or your solicitation to say, hey, I know it's taking longer than normal. We're looking at this market research and we'll give you more information at another time. So we definitely, as a group and as an organization, are moving towards making sure that we are more responsive to you guys and to industry as a whole.
I just wanted to say quickly about sources sought, RFQs, things like that, in particular the sources sought. So I know sometimes a sources sought announcement might not be out for a lengthy amount of time. Like I've known some specialists who've put out a sources sought notice for 3 days. and that's probably not enough time for you all to respond. But sometimes we don't have a choice, so I would just say continue to look for those opportunities. I try to encourage my staff to do at least 7 to 10 days or even 7 to 14 days for a source of salt announcement. But also sometimes we'll put out these source of salt announcements and we don't get any responses from small businesses. So we really need you all to be attuned and respond, because that helps us to determine if we can set something aside for a small business. And also, if what we're asking, if you don't do that, don't respond to the source of salt. Now, if you can find some teaming arrangements and all that, that's good too. But again, if I need some administrative support services and you send me a capability statement for IT support, and then a little small corner, you say, we do a little bit of admin support. I don't think so. If you're heavy in IT, what little admin do you do that's going to help me? So just make sure that you actually read through everything, respond to all parts, and submit us your capability statement. And sometimes the announcement might be geared towards something specific, so you may need to structure your response to make sure you kind of show us like that's exactly what you're skilled in, so again, making sure you respond to all parts and not just saying, I'm gonna just send my capability statement.
Thank you for that. And to follow up on that, on the sources sought notice or any notice that you're responding to that the government has issued, we understand small businesses have a story, and some of you have a really great story, an exceptional story. But when we're putting out notices, I would encourage you to provide capabilities and talk a little bit less about what your story is. Don't waste your pages or the page count, whatever the limit is that's given to you, to tell the story. There'll be a time to tell the story, but what we're looking for at that point is capabilities. Make sure you address the requirements of the announcement. Go through the scope of work and make sure you hit all of those elements. So I just want to give you that piece of advice. And we have time for about 1 or 2 more questions.
Okay, good afternoon. My name is Enette Evans. I'm with GME Enterprises. Ms. Gwynn answered part of my question, so thank you for that. But I had spoken with a small business professional from another agency, and they were talking about how the funding is going to be coming in later. They're hoping mid-April or late April, and how that's going to kind of cause a mad rush again for the 3rd and 4th quarter. And so I kind of wanted to ask you how that relates to like small businesses that are responding to the market research opportunities and trying to build relationships now. How is that going to affect us this year, as for your agencies and your offices?
Well, I can say for us, that doesn't really stop our show in a sense of the funding, because we can't wait. Okay, so we might work a requirement up to award, and then whenever we figure out that the funding is coming, then we'll fund the award. So just because the funding might come late, we still encourage our program officers to get us the information that we need so we can start working early on the things, because I can't wait until June to start working on a requirement, So as soon as my program office is able to get me all the get me the requirement, the PR package, we kind of start working on it. So.
Okay.
Hello, I'm Lee Penton. I have a question for you regarding, let's say we finally get the Teams meeting or in person or phone call. Can you give us kind of a sense on what's restricted whenever we do have those conversations? Because there seems to not be a lot of uniformity in the messages that we receive when we get those meetings.
I think I understood the question to be what's restricted from being shared with industry when you're reaching out. So it depends on the timing of the solicitation. So before our acquisition strategy is released, we're not able to release it to like one particular piece or part of the industry, or even like one vendor on how we're planning to move forward on things like that. Usually at that time, as we're like planning our acquisitions, we're making sure to go out and do like the proposers day, the industry days, things like that, to say, okay, we have these like upfront things coming, and announce the plans as we have them released. But I think that's really
Sounds like it's not necessarily always about the information. Sometimes it's about making sure that you're being fair and providing the same information to everyone at the same time.
exactly
Right.
Yeah.
We have
Thanks.
one last question. I'll So just the short and sweet, the sources sought is looking for capabilities. The request for information is typically a document by the government used when we're trying to really fully define the requirement, and we have some questions and we aren't quite sure. We see those used interchangeably a lot, but they're not necessarily the same. So they are the request for information is for requirements development. The sources sought notice is an attempt to identify capabilities and conduct market research to determine what the acquisition approach is going to be. Anybody have anything to add?
I don't have anything different.
I'm not going to disagree with that either.
So we've got about 4 minutes left in the session. We're actually going to go ahead and end this session early. The next sessions will start at 2:00, and I believe that there are multiple sessions happening at the same time. We know you all are just back from lunch, and we want to give you time to make it to some of those sessions that you were interested in going to. I want to thank the panelists today for showing up here and supporting this. Thank you all for attending, and I hope that you enjoyed the rest of the conference. Thank you so much.